Well, vital signs are just that, vital. They play a particularly important role in the cardiopulmonary examination. Many patients with chronic conditions will have medical equipment on hand that will help you in assessing their vital signs. For example, many patients with a chronic heart condition will have a blood pressure cuff and scale available to them. For heart failure concerns, a scale is particularly important, as sudden weight gain can indicate volume overload. Patients with a chronic lung condition may have a pulse oximeter at home, and patients with asthma or COPD may have a peak flow meter with them. Once you have assessed vital signs, start with the visual inspection. Still images are typically not informative unless the patient has significant signs, such as cyanosis. Video calls can provide a lot more information. Does the patient look like they are in distress? Are they leaning forward to ease the work of breathing? Look for accessory muscle use and rapid breathing. Patients who may look okay at rest could develop significant signs with exertion. For patients who look well and in whom you are not concerned about acutely stressing the heart, consider asking them to walk around the room or do a few jumping jacks, then return to the camera. Do they still look comfortable, or are they having difficulties breathing? You can also assess the peripheral vascular system visually. By instructing the patient to aim the camera at their shin, press down on their shin with a finger, and then let go, you can assess for pitting edema. Significant SOX indentations also signify the presence of pitting edema. If you're concerned about volume status, you can also ask the patient to hold the camera to their neck. Sometimes you may be able to appreciate a jugular vein distension. Keep looking as you ask the patient to press over their right upper belly. This allows you to check for hepatojugular reflex, or an increase in the point where the jugular venous distension moves closer to the ear. To check for adequate perfusion, have the patient aim the camera at their thumbnail. Ask them to press down and let go to assess for capillary refill. The nail should go from white to pink again in less than 2 seconds. If it takes longer, the patient has poor circulation. Next comes the auditory inspection. You can still collect quite a bit of information without a stethoscope. Whether on the phone or a video, listen for shortness of breath. Is the patient speaking several sentences between breaths, or having to take a breath after every word? Does talking or breathing deeply cause them to cough, as is sometimes seen in asthma or bronchitis? Have them take several deep, slow breaths. Listen for wheezing. On a video call, watch for prolonged expiration, an indication of obstructive lung disease such as asthma or COPD. Percussion can be challenging over telemedicine. If there is a friend or family member with the patient, you can ask them to tap with a finger along the back, starting from right below the middle of the shoulder blade down to below the last rib on each side as you watch them and listen for dullness. Self-palpation can be helpful in a patient with chest pain in whom you are considering costochondritis or inflammation of the cartilage connecting the ribs to the sternum. If the pain is reproducible when they press on the part of the chest that hurts, then the pain is most likely musculoskeletal in nature. If you are concerned about a potential serious cause of the patient's symptoms, such as a heart attack or pulmonary embolism, you should send the patient to the emergency room immediately. Once you've ruled out a potential emergency, if you feel that it is safe to manage the patient expectantly without further in-person evaluation or treatment, advise them on next steps in treatment.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.